I understand the advantages of a Medicare Advantage, or the disadvantages are having to stick to a network, co-pays for services. Um, are there any more that could be a downside? I guess finding providers in your current location may be a problem to some people depending on where they live.
Doesn't that seem to be the biggest thing that we find, that if a person has a problem with Medicare Part C, is network and doctors. Some of these insurance companies have done a really good job at trying to establish relationships with hospital systems and doctors, and some are, they struggle with that, and they may not even be in your area because of that. That is the biggest one. The only other one is the feeling that you're maybe locked in. Um,
Mm.
we can cover that another time, but the fact that if I sign up to this thing and I jump off of my Medicare supplement plan or original Medicare and I sign up to this thing, am I locked in? If I don't like it, what can I do? There are off ramps. There
Yeah.
are built-in off ramps that the government has put in place, and one of them is the following year, the first 3 months of the year, you can go back to original Medicare. There's another off ramp. I'm actually glad you brought that up, John. This off ramp is on Medicare.gov,
Okay.
and under the guarantee issue rights. And here I'll give you the scenario. Your aunt is she pays $300 a month for this Medicare supplement that she's had for a long time. She
Okay.
knows it, she loves it, but her income is really low.
Mm.
She cannot afford that anymore. And she's in relatively decent health. She's maybe late 70s. She's in pretty good health, but she's scared. She doesn't want to just go back to original Medicare and risk that. So you look into the Medicare Advantage for her, and you find this rule that if she wants to try out a Medicare Part C or Medicare Advantage plan for 1 year, she can do that. If she
Okay.
likes it, she can stay. If she doesn't like it, she can jump right back on to the same company, to the same plan, and continue on with her Medicare supplement plan the following year. And that's under guaranteed rights situations. So even there's an off ramp.
Yeah.
Go back to the question you asked, John, though.
Uh-huh.
The feeling of being confined or trapped, or I have to wait a year and all those things, sometimes it's not comfortable for people. So
Okay.
that's a disadvantage.